Hey guys, in today's episode, I will be talking about shock, but not the type of shock you get when you see your exam question. The shock I'm talking about is a life and a death situation. So join me and let's educate each other. Welcome to my YouTube channel. I am Nurse Obadun Aderonke, and in this episode, I will be talking about shock. SHOCK, shock. So join me and let's learn. What is shock? Shock is a life-threatening condition that occurs when our organ isn't getting enough blood supply or blood flow, not flowing through them. And we have different types of shock. We have 5 types of shock. We have hypovolemic shock. We have cardiogenic shock. We have septic shock. We have anaphylactic or allergy shock. And we also have neurogenic shock. Hypovolemic shock, like the name implies, hypovolemic. That means low volume of either fluid or blood in the body system. And this happens when there is trauma, severe dehydration, or major burn. Anaphylactic shock or allergic shock. This happens mostly with children when they put something in their nose or they didn't just block their airway, leading them to not being able to breathe. And if it's not removed immediately, it can lead to surrogacy. Cardiogenic shock occurs when there is dysfunction of the heart. That means if the heart muscle is unable to pump blood, it's just the blood is there, but the heart cannot pump blood. This can happen when there is myocardial infarction or when there is heart failure. Septic shock is a result of an infection which make the blood vessel wide open, which can cause BP crashing and also organ failure. While neurogenic shock occurs when the nervous system is damaged, like the spinal cord, and making it not have any vasoconstriction can make the patient warm or pink than usual. What are the causes of shock? Burns causing loss of plasma protein in the body. Loss of H2O and electrolytes, as in prolonged vomiting and diarrhea. Sudden malfunction of the heart, that's when the person is having myocardial infarction. Signs and symptoms of shock: we have restlessness, cold moist skin, rapid weak trending pulse, shallow breathing, low BP, pallor, subnormal temperature, consecrated urine, weakness, and so on. Management of shock: if you are not a health practitioner or you are not a first aider, please rush the person to the nearest hospital. But if you are a first aider, you ensure you do a CPR, you clear the person airway, you check vital sign, and you elevate the person leg. But if it's going to cause them more harm, just let them lie with their face facing up. You can turn their head to one side. What are the complications of shock? Shock can cause metabolic acidosis, cardiac failure, and also cerebral damage. Shock is a life-threatening condition. It can cause death within few minutes. If you see somebody falling or you see somebody that is about to enter shock, rush the person to the nearest hospital if you are not a medical practitioner. Even if you are a medical practitioner, you need help. You need to take the person so there can be a joint help to save this person's life. This is the end of today's episode. I am Nurse Obadu Aderonke. Do you know something that with your like and your comment and your subscribe, it makes me have the zeal to drop more educational video. So if you have not subscribed to my YouTube channel, you can do so now. Also, you can watch my past video, and I've talked about myocardial infarction before, so you can just climb through and watch my video. I will see you in my next episode. Before then, have a beautiful and a lovely weekend. I love you. See you next Friday. Bye.